Hey everyone, and welcome back to MediByte, where we break down complex health topics so they're easy to understand. Today, we are talking about something truly incredible, the science of assisted reproductive technologies. This is the field that has brought so much hope and so many families into the world. If you've ever wondered how modern medicine steps in when the path to parenthood has a few roadblocks, well, you're in exactly the right place.
So to really get why these technologies are so important, we have to start with the problem they solve, and that's infertility. Medically, it's defined as not being able to get pregnant after a full year of trying. That time frame shortens to 6 months for women who are 35 or older. But this is way more than just a clinical definition. For millions of people, it's the beginning of a really personal journey to find answers.
So that begs the question, right? When things don't go as planned, what's next? What kind of options does medicine actually have on the table? The really good news is that today there are more paths to building a family than ever before in history.
Okay, before we dive headfirst into all the amazing tech, it's really crucial we understand the why. What are the underlying causes of infertility? Because really, figuring out the root of the problem is always the first step to finding the best solution.
Infertility is almost never simple. It's usually a pretty complex puzzle. As you can see here, the causes can be anything from issues with the fallopian tubes or endometriosis to problems with sperm or maybe ovulation isn't happening regularly. And here's something you might notice. Those percentages add up to way more than 100%. That's because for many couples, it's not just one thing, but a combination of factors at play.
So, with a better picture of the challenges, let's switch gears and talk about the solutions. What exactly is ART? Well, it's an acronym that covers a whole range of powerful medical tools that are all designed to help overcome those barriers to getting pregnant.
At its heart, ART refers to any procedure where eggs and sperm are handled outside the body, in a lab. You've probably heard the term in vitro, right? Well, it literally just means in glass, which points to the controlled environment, like a petri dish, where fertilization can happen. And the end goal for every single ART procedure is, of course, a healthy pregnancy. Now, not everyone jumps straight to the most complex options. A really common first step that many couples explore is called intrauterine insemination, or IUI. For this procedure, a sperm sample is specially prepared to get just the healthiest, most active sperm. Then, right around the time of ovulation, they're placed directly into the uterus. It's like giving them a head start and a more direct route, which can really boost the chances of fertilization.
All right, now let's get into the one you've probably heard the most about, in vitro fertilization, or IVF. This is a multi-step journey that has absolutely revolutionized fertility treatment. It's pretty amazing stuff.
So the whole IVF process is this carefully orchestrated sequence with 5 key stages. It kicks off with stimulating the ovaries to produce more eggs. Then you have egg retrieval, fertilization back in the lab, watching the embryos grow, and finally, embryo implantation. Let's break each of these down.
Step 1. Ovarian stimulation. Normally, a woman's body matures just 1 egg per cycle. But here, using specific fertility medications, doctors encourage the ovaries to mature multiple eggs all at once. It's all about increasing the odds right from the very beginning, by having more eggs to work with.
Once those eggs are mature and ready, it's time for step 2, the retrieval. Now this might sound intense, but it's actually a minor procedure. A doctor uses an ultrasound to see exactly where they're going, and then uses a very fine needle to gently collect the eggs. The whole thing is quick and carefully monitored. Okay, now for the really cool in vitro part. In the lab, the eggs that were just retrieved are combined with sperm. And then, highly skilled embryologists watch over them for the next few days, looking for the telltale signs of fertilization and growth as they hopefully develop into little embryos. The final step in this whole cycle is the embryo transfer. A doctor uses a thin, soft catheter to place the healthiest embryo, or sometimes more than one, into the uterus. It is worth noting, though, that modern medicine is really leaning towards transferring just a single embryo whenever possible to reduce the health risks that can come with having twins or triplets.
While IVF is definitely a cornerstone of ART, it's not the only tool in the toolbox. Let's explore some other specialized techniques and options that open up even more paths to parenthood.
Okay, check this out. A major advance that's often used with IVF is a technique called ICSI. Instead of just putting the egg and sperm together in a dish and hoping for the best, ICSI is way more direct. An embryologist actually selects a single healthy sperm and, using a microscopic needle, injects it right into the egg. This has been a total game changer, especially for what's known as male factor infertility. For some people, the path to parenthood involves the incredible gift of donated eggs or sperm. This is a really essential option when an individual or a couple isn't able to use their own. Donors can be people you know, or they can be anonymous, but either way, they provide a chance for so many people to build the family they've been dreaming of.
Another really important area involves what's called third-party reproduction, and it's key to understand the language here. You might hear gestational carrier and surrogate used to mean the same thing, but they are very different. A gestational carrier carries an embryo that was created from the intended parent's egg and sperm, so she has no genetic connection to the baby. A traditional surrogate, on the other hand, uses her own egg, which makes her the genetic mother. This is a critical difference, both legally and emotionally.
All right, now for a really crucial part of this whole conversation, the outcomes. Art offers so much hope, but it's really important to have a clear-eyed view of both the success rates and the potential risks involved. One of the biggest factors that influences success with art is, without a doubt, the woman's age. If you look at this chart, for someone under 35, the chance of a live birth from one egg retrieval is about 45%, but you can see that rate drops off pretty steeply with age, down to around 9% for women between 41 and 42. This data really highlights why age is such a big part of any fertility discussion.
So what about the risks? Well, the number one risk associated with ART is actually a multiple pregnancy, so having twins or triplets. Carrying more than one baby increases the chances of complications, like preterm delivery for the babies and things like high blood pressure for the mother. And there is a slight increase in the rate of birth defects, but it's important to see that in the right context.
To put that risk in perspective, you have to remember this key fact. Millions and millions of babies have been born thanks to IVF, and the vast, overwhelming majority of them are perfectly healthy, with no birth defects at all. So while it's vital to know the risks, this technology has a very long, very proven track record of being safe.
And that really brings us to a final thought, looking toward the future. As science keeps pushing forward, we're seeing breakthroughs in genetic screening and embryology all the time, it's pretty exciting to think about what's next. How are these evolving technologies going to keep shaping and maybe even expanding our very definition of what it means to build a family?
And that is our look into the world of assisted reproductive technologies. Thank you so much for joining us for this MediByte Explainer.
If you found this information useful, we'd really appreciate it if you'd hit that like button, share it with someone who might find it helpful, and of course, subscribe to MediByte for more clear, trusted health content just like this. We'll see you next time.